is Dan Fackrell. I'm an endodontic resident at the University of Connecticut Health Center in my third year. Entering college, I got into the life sciences, biology, zoology, and I didn't want to necessarily be a medical doctor, a physician, but I wanted to, and I didn't want to get into a purely research field. So I wanted to be able to again, take care of patients, help them do something that they're not able to do for themselves, and sort of kind of play a role in the community I live in, and take that position in my community as a dentist, as someone that can fulfill that role in the community. You know, a good definition is the treatment or the prevention of periapical periodontitis. I mean, that's, we want to, if someone already has a infected root canal that needs, and an abscess that needs treatment, root canal therapy, endodontics will treat that. Or if a person is heading that way with a toothache, preventing it before it happens by treating it with a root canal. There's also a surgical aspect of endodontics, which is apicoectomies, treating the surrounding area of the roots of the tooth. But I mean, the primary thing is, for me, is taking care of the patient and making them comfortable, making them, helping them overcome this infection or this pain that they're experiencing, helping them to feel good again. Initially, when I was before dental school, when I was an undergraduate, I did some research, just research paper on root canal treatment. So that was the initial attraction. I guess I didn't know anything about root canals prior to that, but then through dental school and my experiences in dental school in the endodontic clinic with the residents and the faculty, it just was appealing. And then in private practice, like I said, it was just a rewarding feeling when I was able to help people in pain or who had abscessed teeth. And I enjoyed when I did those procedures, as opposed to other procedures that I didn't enjoy as much. Endodontics, for me, is kind of the essence of dentistry. I mean, if you look back in history, people only dealt with their teeth if they were hurting. So as I practiced dentistry, first in school and then in general practice before the residency, I kind of just got a good feeling when I was able to take people out of pain with endodontics. I graduated in 2005 from UConn here, and I went and did a GPR first at the University of Utah in Salt Lake City. Got a lot of endo experience there, and then I did private practice first in the Salt Lake area and then in Southern Oregon for a couple years. But I realized I wanted to pursue endodontics probably a couple years after graduation, after I'd been in private practice a while. I hadn't initially considered it because of timing. I mean, I'm a little older than most dental graduates are, so I just wanted to get out and work. But once I got out, I felt, I wanted to do that, so I just kind of forged my path to head back to the residency. Go after what you like. I mean, I know a lot of some students, there's popular residencies, popular specialties that everyone kind of wants to pursue, ones that potentially can make more money, these kind of things. But I would say go and do what makes you happy, you know, more than income, I guess. Get to know your faculty and residents at your school, first of all, and seek their advice would be my first recommendation. But also kind of read up on, you know, where you're applying, the faculty, the director, read some of their published research, things like that, so you're familiar with who you're talking to, kind of be up to date on the science of the specialty, and also know a little bit about the classic literature, you know, just the overall scope of for me, endodontics.